Hi, good morning. My name is Anthony and I'm a respiratory student from the respiratory department. First is I'm gonna wash my hands, then wear appropriate PPE, and then would you mind if I'm going to stand beside you? I still have to check your ID card to ensure correct identification. So once I'm done, I'm going to reassess the patient, check their vital signs, and then I'm gonna explain everything what I'm going to do. So the doctor ordered you to being put up with an oxygen, and then because I look at your chart and it also coincide with the patient's with the doctor's orders. So I also observed that you're having COPD, and then I also observed the patient to be lethargic, not too responsive to what I'm trying to talk. So I'll just have to put up with a venturi mask, especially the patient is COPD, because in order to have a fixed FiO2 that they receive and blow off more carbon dioxide. And then the doctor ordered a 28% FiO2, so I already set this one up, the 28% in here. So regardless of the flow that we give, still the patient will receive FiO2 of 28%. So first is we have to loosen this one first, and then we have to check if there's air coming out. So we're going to put this in the patient's face, make sure it's not too tight, and then we have to adjust, make sure that there will be no leak coming out, not too tight, as long as the patient receives the full oxygen that they have to be. So now that I already gave this one to the patient, I'm going to leave and then reassess later on. So now that I already have lapsed about few hours, I received a call from the nurse station that the patient is kind of conscious already, and then I also try to look at the labs, especially the ABG. They're already in normal limits, and also their SpO2 is kind of corrected already. So I also receive a call from the same nurse that the patient is kind of suffocated and also wants to eat. So I'm going to shift it with a different device. So hi. So I noticed that you were already feeling well. So I'm going to wash my hands first. So my name, by the way, is Anthony, and then I'm going to reassess you again, check your vital signs and everything, and then once I'm done, I'm going to proceed in what I'm going to do. So by the way, Mr. Phillips, I received a call that you were doing fine. I also checked your EBG, that your EBG result was already within normal, and then I also received a call, by the way, that you also want to eat. So I'm going to change your device to a different one, and because your labs and everything are doing okay, I just have to remove the venturi mask, and change it with a low flow device. And because you were receiving a flow of 28% FiO2, so I'm going to give you a flow of nasal cannula of about 2 liters per minute. So that would be equivalent to 28% FiO2, because we have to convert it to 2 liters times 4 plus 20, so equivalent to 28% FiO2. So I'm going to turn this one off first, remove, and then I'm going to loosen this one a little bit, then remove the device, put it in a safe or clean plastic, and then first is we have to loosen the nasal cannula also, and then put this one to the oxygen source, and then we have to set this one to 2 liters because it is equivalent to 28% FO2. Then before putting it to the patients is we have to fill the prongs if there will be air coming out. So I've noticed there are air, so I'm going to put this one carefully to the patient's nose and also attach it to the earlobes, and then tighten this one up in order to have accidentally removed from the patient. So, Mr. Phillips, so now that I shifted this to a different device, you're now able to talk and also you're able to eat. And by the way, I just have to give you some safety concerns. I will just have to prohibit from putting up any Vaseline on your nose because this one is oxygen. And then once you're unconscious,